Hello, everyone. Welcome to another episode in medical writing. This is Dr. Muhammad Salman, and today we'll be discussing the reasons for manuscript rejection even before peer reviewing. So beginning, we have to know what is the editorial process. So after finalizing your work and choosing the suitable journal, you go for submission and you submit to this journal according to its guidelines. So the first thing it goes into is the pre-check, which is usually an editorial check. If it passes that pre-check, it goes to a peer reviewing process with selected experts who review your work. And usually they give their decision to the editor-in-chief, and the editor's decision is either rejection or returning this paper with minor or major revisions. And after this revision, it's also peer reviewed and by the reviewer selected for your paper, and they mention if they're satisfied with this revision or it still needs work. So after that, the editor either rejects or accepts the paper. So in the next sessions, we'll be talking about causes of rejection in the peer reviewing or after the peer reviewing process. However, there are a lot of reasons for rejection in the pre-check itself. So a very important question is, should journals accept all manuscripts? Of course, if you listen to this question, you will say absolutely not. But from an editor-in-chief's point of view, they look to a manuscript in two ways. So the first question is this manuscript suitable? The second question is this manuscript potential or interesting? Regarding the first question, is it suitable? The manuscript should be suitable to the journal itself. It should be suitable to the aim and scope of this journal and the readers who are interested in this journal. The manuscript also should adhere to a high quality research and ethical standards. This is really important to rise up to the standards of the journal. So is it suitable? If yes, let's take a look about its potentiality. Is it potential, or is this area of research interesting? So another point is that the editor-in-chief takes a high-level look at the paper in the beginning. If the topic is appealing, they may take a closer look and send it for pre-check. So today, as we mentioned, we will be talking about reasons of rejection in the pre-check and the pre-reviewing part. So the first cause of rejection is lack of novelty or originality. You have to know that journals strive for novel ideas. The research, if the research is answering an old question, an answered question, it will be rejected because it's a repetition of an already answered question. For example, if you're a researcher and you're talking about the efficacy of MTX in mild to moderate RA, this question has been answered several times in many years ago. So if you're going to do it and repeat it again, it's not going to be appealing to any reader because they already know the answer. However, if you look at a novelty, you can look for the efficacy of new biologics, for example, in mild to moderate rheumatoid arthritis. This is a novel and an original idea. Another example is if the research question is obsolete. So for example, if there's a treatment regimen that's already obsolete and it's not used anymore and it's replaced by a new treatment regimen. So talking about or researching or looking for a question, for an answer in a question that's already not used anymore, this is a cause of rejection. For example, if you're making a study on real world evidence on the role of beguilated interferon in managing SUV, no journal worldwide will accept this because beguilated interferon already is not being used in the treatment of HCV. And there are new DAAs and new regimens in managing HCV. So if you have an idea, do your homework. Please, as much as you can read, look for the research question and look if it has been done before, and make sure your idea was not conducted before, and discuss your idea with experts. And this is really useful because sometimes we miss certain literature in our search. So if you talk with an expert, they will guide you. They will tell you if this idea is novel or not. What could you do to make it novel, and how can you tweak it so it could be interesting for the scientific community and for the journals as well. So discuss your idea with experts before starting. They may even tell you that it's already being conducted and it's going to be published soon, for example. So you don't waste months and months of work and then find another paper publishing it a few months before you finish. So ask experts and colleagues as well if they believe your idea is interesting. So discussing it with them, if this idea was in the literature, would you read it or not? Would it be interesting or not? So novelty is very important. It's usually one of the early causes of rejection if your paper was not novel or not original. The other thing, if your paper is out of scope, again, we see this a lot. So nothing is wrong with your paper, I can guarantee you that, but you're in the wrong place. For example, the paper does not fall within the journal's aim and scope. So if you're submitting a paper on breast cancer in a cardiology journal, this is completely out of scope, so it will be rejected. Another example, if the topic is within the journal scope, but it's not appealing enough for readers. For example, lack of international importance. Not all local data are interesting to the world. So if you're submitting a clinical characteristics of a national COVID-19 data related to a certain region in a certain country, that will not be appealing to the readers of Lancet Infectious Diseases, for example, who are mostly from all over the world, US, European, Asian. If you submit a data related to your local practice, that will not be as much appealing as the journal would believe. So what should you do to avoid out of scope rejection? First, you have to read the aim and scope really, really well and make sure your topic fits in it. So don't go to journals that are not specialized in your specialty, and read the scope very well before choosing. The second thing is choose trending topics and unanswered research questions. So some people may push back on the trending topics issue. However, this is the reality. For example, we all saw in the COVID era that most of the papers were related to COVID-19, and any papers rather than COVID-19, especially in the beginning, was not of interest to most journals. An unanswered research question, even if it's an old research question and it's not answered, and you provide new answers for it, it's going to be very intriguing to journals to accept it. Ask the journal if you're not sure, simple as that. So if you believe that you are within the aim and scope of the journal, if you believe that your topic is appealing enough, but you don't want to waste much time, you can ask the journal, and that's why pre-submission inquiries are important. You can send them that you are conducting a paper, and you may even send the abstract of your paper, and they can decide if you could continue the submission process or you should not. So that's the second part. The third part, which is the most common and we see on very frequent basis, is failing the technical screening. As we can do this all day. For example, if you send it to a journal, submit it to a journal, and they reject for failing technical screening, and then you submit it again with incomplete guidelines, not going with the guidelines 100%, they can reject it again, and then you send it again, and we can stay like this forever. However, there are common reasons for rejection related to failing technical screening. For example, plagiarism. Plagiarism is very important that you try to avoid as much as you can. You can only have a 10%, maybe 15% similarity. It could be acceptable. However, more than that, that's not acceptable for most journals. However, it differs from one journal to the other. Another thing is poorly written papers, which is very important, especially in populations who are not native English speakers. So you can find a paper in poor language. You can find a lot of repetitive words and phrases. You can find the sentences hard to read, and you can even find sentences that are difficult to understand. If the pre-check finds a poorly written manuscript, they usually reject it and ask for English editing. So the third thing that causes also rejection is a too lengthy paper. Word count is very important. Check the guidelines, the journal guidelines for the maximum word count. So if the word count exceeds the maximum word count present in journal guidelines, that could be a reason for rejection and asking you to shorten your paper to the maximum word count. The other thing is not following journal structure or formatting requirements. And I believe this is an unprofessional mistake. So you have to read the author guidelines carefully and step by step, and do not miss anything. You have to follow the journal structure and formatting. For example, if they want the abstract to be structured, make it structured. If they want it one paragraph, make it one paragraph. If they want the conclusion with the discussion session, make them one. If they want it separated and each with a subheading, make them separated. So follow the journal formatting requirements by word. The other thing is, which is really crucial, ignoring research ethics such as consent forms. So if you have a research paper and a consent is required, you have to have, for example, the IRB approval. You have to have the IRB approval number, which IRB gave you this approval. All details are very important. If you have a case report or case series, also you should have hard copies of and scanned copies of their consent forms. So to avoid falling in these mistakes, it's very important to take your time in reading, understanding, and following author guidelines. It's very important. Read them and know them, and even summarize them in a piece of paper beside you, just not to miss anything. The second thing is, you have, if you are not a native English speaker, have your paper reviewed. English reviewing and editing is a must. So ask for a colleague's help, or even you will find a lot of paid services, a lot of websites that do English editing and reviewing. Even the journal itself that you submitted your paper in, they would have recommended websites that make English editing or edit your paper for you. So the other thing, which is very important, is you always, I mean always, 100% use plagiarism checkers. These softwares help tell you what's the percentage of similarity in your paper. So use programs like Turnitin, like Authenticate. These I have personal experience with and have a good experience. However, I've used in the past several softwares which I did not find up to the same level as these two. Other failing technique screening mistakes are that the paper lacks key elements. And I just want to highlight in the previous slide that we can do this all day. No, you can't. Of course, there's a limit. After several times, the journal may permanently reject this paper and not accept it again. So another mistake we always see, that we find papers that lack key elements. Sometimes they forget to put titles in the body of the manuscript. They sometimes forget to put authors' names, the authors' affiliates. Some people forget to put the keywords, and even some authors forget to put the tables and figures, and this is crucial as well. Another point is putting figures that have low resolution or unclear, or even with incomplete data. So it's very important to make sure that your figures are with high resolution, and usually the resolution is present also in the author guidelines, the preferred resolution. Another point is the references, which is very, very important, that references should not be old all the way. You can have one or two old references if there are no new ones. However, if most references are outdated or old, this is not acceptable. You cannot find incomplete references in your reference list. And if you're not following the recommended referencing style, that's also a reason for rejection. Another cause of rejection is republishing findings that you've already published, and I think that's not ethically accepted to repeat your work in other words and rewrite it to republish it in another place. Also, journals check this, and if it's found, it gives a bad image. So what to do to also avoid these mistakes? Please take your time in reviewing the document you'll upload. Review it once and double check it, that all the key elements are there, all figures, and check the resolution, the referencing, step by step, all the author guidelines, check them step by step and make sure they are well written and addressed in your manuscript. Double check your figures and the resolutions, and always ask for help if you don't know. If you don't know how to make a high resolution figure, ask for help. You can always find it either through your colleagues or online. Reviewing references is boring actually, however it's absolutely necessary, so don't miss that step and just submit it, because it will return back to you and you have to again review it clearly. So thank you so much for listening. I hope this was useful. The next sessions we will talk more about reasons we see after the reviewing process and causes of manuscript rejection. You can always ask. I'm open to answer any questions you have through LinkedIn or through YouTube. Thank you very much for your time, and looking forward to meeting you in next sessions. Thank you so much.